Whether you're looking for answers to specific life questions or simply hoping to become the best version of you possible, welcome to the Mental Breakdown and Psychreg podcast, where we offer insight, information, and strategies based upon research and years of practice as psychologists. So sit back, have a listen, and get connected with our hosts, Dr. Berney and Dr. Richard Marshall. Welcome back. Today we're going to talk about some of the causes associated with OCD, and we're going to kind of wander around a little bit through a couple of different articles because the approach that some of these authors took is really interesting. So that'll be fun to talk about, but we're going to try to hit some of the big theories, I suppose, but also some of the things that we know seem to happen and know are associated with OCD. So we're going to start out with an article from Psych Central that does, as you mentioned just before we were starting to record, you said we're going to take a romp.
To romp through history.
Yeah.
So it's interesting because I have to go back and look at a fully developed chapter on this topic because most of what we read about causes is currently how we feel about it. But it's interesting to go back and we mentioned in yesterday's podcast that this disorder's been identified for about 300 years already. And so 300 years ago, we didn't have neuroimaging and neurology and all that. And so the causes then were very different. You know, the causal explanation of OCD was very different a couple hundred years ago than it is today. So it was interesting to see this little historical ditty. Yeah, because back in the late 17th century and early 18th century, you know, there was a lot of attributing these types of behaviors to religious perspective, which was very common for the time. You know, they associated a lot of issues with a lot of medical issues, mental issues with hexes and demonic possession and those types of issues. So even bad behavior, But you think of things like epilepsy and other kinds of loss of control disorders. That they had no other explanation for, and so they said, well, it must be the work of the devil. Right.
Fascinating enough, and this is just sort of a brief tangent, there are some still today who hold some of these beliefs, and we've heard stories of religious groups who attempt very intense religious rituals to treat people with various mental health conditions. There was a case probably 10 or 15 years ago of a child with autism who passed during a religious procedure to attempt to cure the child of whatever religious affliction they believed was causing his autism. And the child ended up passing away. So some of that still occurs.
And there are cultures. I mean, we need to be culturally sensitive. There are cultures that today do believe that certain conditions that we would say in Western medicine are medical problems. There are some cultures that have yet to change their views, and they do believe. Epilepsy was one, because I worked in an epilepsy clinic, and there were certain cultural groups that would come in there, and you would ask them to take medication, and they would agree, but you knew they weren't going to take it because they didn't believe that it was a medical problem.
And that is not to say, certainly, that religious perspectives and religious rituals don't help some mental health issues. There are plenty of people with anxiety and depression and things like that who, through religious and faith beliefs, find a lot of relief in their symptoms. And, one can argue the religious viewpoint as well as the secular viewpoint as it relates to why that benefit occurs, but it doesn't change the fact that it occurs.
We don't have any trouble talking about the placebo effect. No, but then when we say, well, it's the power of prayer, then no, it's not that. we're okay with placebo.
Right.
So there's something else at work
Right,
here.
exactly.
So we shouldn't, let's be tolerant and understanding rather than poo-pooing anything. So
right. As time passed, we moved from it being so specifically a religious-based issue, and then we get to sort of the psychoanalyst Freud.
That's right. That's the next stop along the way.
Right.
If you think of this as a train, you begin with demonic possession, which lasted for thousands of years, probably. Some kind of the work of Satan. When people saw the world as a battle between good and evil, which we did for a long time, at least until the Renaissance or the Age of Enlightenment. So we're up to into the 1700s.
Right.
That we attributed this to the battle of good and evil.
Right.
And so if somebody was, look at child rearing. The phrase "beat the devil out of him," because children who misbehaved. Nobody thought about ADHD or early onset bipolar disorder or autism. All those disorders were around then, but people didn't know the causes, and so we attributed it to some kind of the work. It's the work of the devil, so you beat the devil out of them. So, so yeah, that was the explanation. But then, by the time you get to the 1800s, Freud comes along and says, "Wait a minute, there's another explanation here. There could be something else." So he appears on the scene. Right.
And Freud famously documented his psychosexual stages of development. And, we need to do a week, at least, on Freud sometime.
Thank you. I've been saying that for a year.
Yeah, because it is remarkable how embedded some of his views are in popular culture, and we have no idea. So for example, when we refer to someone who is sort of obsessive and has some of those obsessive tendencies, and we refer to that person as anal, being anal retentive or whatever, that is a direct reference to Freud's psychosexual stages of development. And so he mentioned that and believed that a lot of obsessive compulsive tendencies, cleanliness, orderliness, that type of control, is rooted during the stages of development associated with potty training and toilet training and those kinds of things.
You have an unresolved, what Freud said, Freud, I love Freud, he was the first child psychologist, actually. The first one who said, children are not just little adults.
Right.
They're very different in all ways. And so he said, as they develop, they have these conflicts.
Right.
And to try to resolve issues. And if they can't get them resolved, it creates anxiety.
Right.
And it's the anxiety that produces the obsessions or the compulsions.
Right.
Okay? So he spoke about this, but he attributed it to the inability to resolve the conflict and the creation of anxiety. And so you develop these things.
Right.
From Freud, we moved to behaviorism because that's the next stop along the way.
Right.
And people said, no, these are, you just learn, you make some connection between an object and a feeling, and you link those two things together. That's what they mean by learning. It's not like you go out and practice.
Right.
You link this to this, and then you have an obsession.
Right.
Right.
We kind of talked about that a little bit on Monday when we were referring to the baseball players.
Right.
You associate wearing a certain pair of socks with having a good game, and so now every time you're playing, you have to wear those same socks, and that's how, the behaviorists kind of, explain obsessive compulsive disorder.
The only problem is that if you have compulsions without obsessions, how do you?
Right.
It's
difficult.
There's no learning that occurred. You just do it.
Well, but
you're not doing it in response to an obsession.
But at the same time, I don't know that the behaviorist would be all that concerned about obsessions. Because those are thoughts.
Right, that's right.
And they're not. Right. They don't really care too much about thoughts as much as they do about the behaviors.
Right.
So.
But you're doing the behavior to whatever it is.
Right.
The response to that is. But then you have the behaviorists, and so we continue to refine or reconceptualize.
Right.
What we think causes these things.
Right.
And now, of course, we're moving into thinking.
Right.
You know, it's the way we think about things, or maybe it's something about the brain.
Right.
You know.
Right.
You know, we used to criticize. We tend to criticize people in the 1600s who attributed things to gods and devils. You know, good angels and bad angels. And now today we say, well, it must be the brain. You know, it's just as mysterious in many ways.
Right.
But now we say, no, the brain is doing something. We don't know exactly what it is.
Right.
But it's doing something.
Right.
So,
Yeah. And
good old brain.
And we talk about it often that, you know, the research will say that there's a relationship between or this aggregated data suggests that, you know, when we put everything together, people with OCD have a little bit of a different in this area of the brain, but
excellent.
But
point.
we can't diagnose it with that.
Large groups of people who have OCD, their brains tend to have this little thing. Okay?
Right.
But we can't say this person, because there are a lot of people who have that and don't have OCD.
Right.
Okay.
Yeah.
So we're just beginning to till that soil. So we have to be very careful about it probably has something to do with the brain, but it's not a complete explanation.
Right.
Okay.
Yeah, and it has to do with, you know, sort of the midline prefrontal cortex. They
Something
think
about the front. Yeah,
but
the
they're
front
not
of the
sure.
brain is involved, of course.
Yeah,
it's
always
in
involved.
everything.
So there are some theories to suggest that there's some brain differences.
Right.
There's some concerns about neurochemistry, especially as it relates to serotonin and norepinephrine. But those are also implicated with other anxiety-related disorders and depression and things like that.
So we have this historical thing, but that brings us to... You posted 2 articles on this, didn't you?
Yeah, a few.
What was the second one?
The second one is from the Mayo Clinic.
Mayo Clinic,
Yeah.
right. And that I think is probably as a very succinct, nicely organized explanation of causes.
Right. Yeah.
They do a good job at Mayo Clinic.
They do. So in addition to some potential concerns about brain structure and brain chemistry, there seems to be some genetic predisposition. So like with many conditions, if you have a very close family member who has symptoms associated with OCD, you're going to have an increased risk for presenting with those symptoms as well. So there is a heritability factor associated with OCD, suggesting perhaps some genetic component to it. But there's also things in the environment.
That's right, environmental conditions.
Yeah. So, you know, there's a great video, and I have to see if I can find it again, because the link that I had to it is now broken, so I can't find it. But there was a great video from the UK of a woman receiving treatment for OCD. She's talking about it, and it shows some of the treatment approaches, and some of the stuff we're going to talk about on Saturday. But the link that I have is broken, so I have to do some more intense searching for it. Hopefully it's available. But the really interesting thing with that is that at some point in there, this woman with pretty severe OCD is talking about her 1-year-old, and she said that she decided that treatment was necessary when she started to notice OCD-like behaviors in her son, who was only 1 or 2 years old, because she noticed that he was kind of doing some of her same ritualistic things with washing his hands. And so, again, we have some of that sort of family history, some of that modeling perhaps, and some of those kinds of tendencies that can not necessarily create the disorder, but can certainly manifest as symptoms associated with the disorder.
The same symptoms, right.
Right.
So basically we divide causes into biological, genetic, and environmental.
Right.
So back we come to the biopsychosocial model, okay? And it's, for most of these disorders, I think we're talking about a biopsychosocial model. Bio is the biological, usually brain, chemistry, and chemical and structural. Psychological is temperament,
which is rooted in genetics.
It's inherited, the genetic component, and the social is the environmental. Right. And so those three. Now, when when I worked with children who had impulsive aggression when I was at the University of Texas, we used to say it's biopsychosocial, and you can usually get away with having one or two of those.
Right.
But if you have all three,
Right.
if all three, so in this case you have a biological marker, you have a genetic, you have an inherited component, and you have a violent or stressful, some kind of environment. If you stack all three of those things,
right.
the disorder is probably going to express itself.
Right.
If you only have one or two, it may not. And so they talk in terms of risk factors.
Right.
That they also increase the valence of each cause.
Right.
So.
Now, one last piece that we're going to talk about is a relatively new
Yes.
phenomenon that we're noticing that's come from the research, and we have some friends who they began the research at the University of Florida, but now they're with the University of South Florida. But there's a lot of other groups doing research with this as well, and it's called Pandas.
Pandas.
Pediatric autoimmune neuropsychiatric disorders associated with strep.
You'll never remember that.
Yeah, but you'll remember
it takes
pandas.
a long time to remember. Just pandas.
Pandas. Right? And what this suggests, and there is this phenomenon where following a strep infection
right.
of some sort, many times kids will demonstrate various neuropsychiatric symptoms.
Right.
Those symptoms can be hyperactivity, impulsivity, tics. But oftentimes they are OCD like
right.
in their presentation, and so there is a whole line of research now going out to look at neuroinflammation and things like that associated with strep infections that may be related to the presentation of OCD.
That's right. But this is a sudden onset of symptoms.
Right.
It's not.
It's a little bit different than the other.
That's right. It's sudden and profound.
Right.
There's no question that something is amiss. So if you have strep or your child has strep, keep in mind that it could become pandas.
Right.
And you want to keep an eye out for that.
Absolutely.
But it's a very sudden onset. It's not gradual, and it's not does she or doesn't she. You'll know. It's pretty profound.
Yeah, absolutely. So, all right, that is it. Tomorrow we're going to talk about some of the other disorders associated with or related to OCD, which is going to be a fun conversation.
That's a fun conversation. Right.
But before we go, one last reminder of the Coming Out of the Darkness, A Concert of Hope. That'll be tomorrow night, Thursday, May 24th at 7:30 p.m. at Theater Winter Haven. That's THEATRE, winterhaven.com. Go to the website, contact them for some more information. But this is a program that's all about suicide prevention awareness. Proceeds are going to go to local community mental health agencies as well as the American Foundation for Suicide Prevention. This is like a great program for a great cause. So if you're in the area around Winter Haven, Central Florida, we encourage you to check it out.
And keep in mind that 13 Reasons, Season 2, started again.
Yeah, we're going to have to...
We're going to be talking about that.
We're going to have to do a week on that, I think.
Yeah, sadly, suicide rates are up in youngsters and teenagers.
Yeah. So, all right, that is it for today.
Yes.
Until next time, stay happy, stay healthy, and forget to be afraid. Thanks for sharing this episode of the Mental Breakdown and Psychreg podcast. Be sure to check out the show notes for links to follow us on Twitter and subscribe to our YouTube channel, where you will find all of our previous podcasts and much more. We would be honored if you would become a patron through patreon.com, where any donation you can manage will go to the development and creation of more content. Just visit patreon.com/thementalbreakdown for more information. Thanks again for listening. Have an awesome day, and we look forward to being back in your feed tomorrow morning.